The Hughston Posteromedial drawer test. The subject lies supine with the test hip flexed to 45 degrees, knee flexed to 90 degrees, and the tibia internally rotated 20 to 30 degrees. The examiner will sit on the subject's foot with both hands behind the subject's proximal tibia and thumbs on the tibial plateau. The examiner will apply a posterior force to the proximal tibia. A positive finding will be an increased posterior tibial displacement, particularly of the medial tibial condyle, compared to the uninvolved side, is indicative of a posteromedial rotary instability. Now the Hughston Posterolateral drawer test. The patient will stay laying in the same position, only this time the tibia will be externally rotated 20 to 30 degrees. The examiner will sit on the subject's foot with both hands behind the subject's proximal tibia and thumbs on the tibial plateau. Again, a posterior force will be applied to the proximal tibia. And a positive finding will be increased posterior tibial displacement, particularly of the lateral tibial condyle, compared to the uninvolved side, is indicative of a posterolateral rotary instability. Special considerations and comments for these tests. It is important to maintain quadriceps and hamstring muscle relaxation during this test. While applying a posterior force, the examiner should carefully assess any posterior step-off from the tibial plateau on the femur. There is no known specificity or sensitivity to these tests.